Welcome, dear doctors. I appreciate the opportunity to go through into a discussion today on a case that reflects a frequent scenario we encounter in clinical practice. Our focus is on a disease that is unfortunately commonplace yet remains a serious global health concern: chronic obstructive pulmonary disease, or COPD as we commonly know it. Our patient today is a 65-year-old woman. She has a known history of COPD, which is significant as it is a progressive disease characterized by worsening lung function over time. This existing condition already presents a foundation for potential acute exacerbations and complications. On the day of her visit, she presented with a sudden onset of breathlessness and a cough productive of green sputum. The abrupt onset and change in sputum color are critical features in this case. As you all know, such symptoms often indicate a severe underlying issue that requires immediate attention. Breathlessness is a cardinal symptom of COPD, but a sudden increase often suggests an exacerbation or secondary complication such as a respiratory infection. Moreover, the green sputum hints at the possibility of a bacterial infection, which could be the trigger for this exacerbation. In essence, this case represents a common but complex situation we encounter regularly in our practice: a patient with a known history of COPD presenting with signs of an acute exacerbation. It tests our ability to rapidly and accurately diagnose the situation, initiate suitable management, and navigate through the complexities of COPD management. This emphasizes how important it is for us to notice even small changes in a patient with long-term health problems. These little changes could signal serious issues on the horizon. As we go through this case, I encourage you to reflect on similar cases you have encountered in your practice and the approaches you took in managing them. Let's immerse ourselves in this case with the goal to learn from each other and enhance our collective understanding and management of COPD. Alright, let's take a closer look at the details of this case. The patient we're discussing has been dealing with COPD for a long time. She walked into our clinic in a state of distress, struggling to breathe all of a sudden, and coughing up greenish sputum. Now, this didn't gradually build up over time, it came on suddenly just 2 days before she came to see us. And what's more, it was getting worse day by day, with her breathing difficulty and the intensity of her cough both increasing. This severe increase in her symptoms over such a short period is a key feature in our discussion today. Let's get more specific about the patient's history. When we had an in-depth conversation with her, a few important details came to light. The first was that she had been running a low-grade fever. This can often be a sign of an infection or some kind of inflammatory process going on in the body. Secondly, we learned that her usual COPD symptoms had been getting worse over the previous 2 days. COPD is a chronic condition, so it's common for patients to have some ongoing symptoms. However, in this case, the symptoms were getting worse, not staying stable or improving. This increase in symptoms is a warning sign that something new and potentially serious might be happening. An essential part of her history is that she was already on regular inhaler therapy for her COPD. Despite using her inhalers, as usual, she wasn't experiencing any relief from her symptoms, which is unusual and concerning. Lastly, she shared that she had been a smoker for 40 years but had successfully quit smoking 10 years ago. We know that smoking is a major risk factor for developing COPD, and even though she quit smoking, the damage from those 40 years would have already been done. So, overall, our detailed history gave us several clues about what might be causing her sudden breathlessness and worsening symptoms. Moving on to the physical examination and investigations, let's break this down a bit. Upon examining the patient, it was immediately clear that she was struggling to breathe. This distress wasn't just evident in her expressions of discomfort. Her physical state confirmed it. Her breathing was labored, meaning she was using a lot of effort and energy to get enough air in and out of her lungs. We also noted that her breathing rate had significantly increased. Usually, this happens when the body isn't getting enough oxygen and is trying to compensate. On auscultation, her breath sounds were decreased, which might suggest that not enough air was flowing in and out. The expiration was prolonged, a classic sign of COPD, where the airways are narrowed, making it harder for air to leave the lungs. We also heard coarse crackles, which are abnormal sounds often caused by fluid or mucus in the airways. Because of these findings in her symptoms, we immediately ordered a chest X-ray. The images showed us that her lungs were hyperinflated, or larger than normal. This is common in COPD, as the struggle to exhale fully can trap air and cause the lungs to expand. However, the X-ray also showed patchy areas that looked denser, known as infiltrates, which often suggest an infection in the lungs. Finally, we collected a sample of the green sputum she was coughing up to send for laboratory testing. By culturing this sample, that is, trying to grow any bacteria or other microbes that might be present, we hope to identify any specific infectious agent that might be contributing to her sudden worsening symptoms. Moving on to our clinical reasoning process, I'd like to explain how we reached the diagnosis for our patient. The first and foremost aspect we considered was her history of chronic obstructive pulmonary disease, COPD. This is a long-term, progressive disease that doesn't just disappear, and thus, it plays a significant role in her health status. The sudden worsening of her symptoms was the second critical aspect we considered. Her breathlessness, along with the cough and greenish sputum, suggested that something had changed. Given COPD's chronic nature, sudden changes like these often indicate an exacerbation, or a flare-up, where symptoms get noticeably worse. The third piece of the puzzle came from our examination findings and the chest X-ray. Her physical distress, abnormal lung sounds, and the hyperinflation visible on the X-ray all aligned with a COPD exacerbation. The patchy infiltrates suggested an infection, likely bacterial, given the green sputum. We, of course, had to consider other possibilities. Conditions like congestive heart failure and pneumonia can cause similar symptoms, and it's crucial not to miss these diagnoses. Heart failure can cause breathlessness and fatigue, and pneumonia can lead to cough, breathlessness, and fever. However, in those cases, we would expect to find other signs and symptoms, such as swelling in the ankles or a different pattern of lung sounds and infiltrates on the X-ray. But in this instance, every piece of information pointed towards an acute exacerbation of her COPD, likely caused by a bacterial infection. This line of reasoning led us to the diagnosis. However, remember, clinical reasoning is a dynamic process. We would be ready to reassess our patient and reconsider our diagnosis if new information or findings emerged. Let's move on to how we managed this case and what the outcome was. After reaching a diagnosis of an acute exacerbation of COPD, probably secondary to a bacterial infection, we implemented the management plan without delay. In this kind of situation, where the patient's breathing is heavily compromised, time is of the essence. Our treatment approach was guided by the standard guidelines for managing COPD exacerbations. The first thing we did was provide the patient with supplemental oxygen. Oxygen is a basic yet crucial element of care for any patient in respiratory distress. It helps to correct hypoxia, or low oxygen levels in the blood, which can cause severe complications if left unchecked. We also started the patient on nebulized bronchodilators. These are medications delivered in a mist form that the patient breathes in. They help to relax the muscles around the airways, making it easier for the patient to breathe and reducing the sensation of breathlessness. In addition, we gave the patient corticosteroids, which are powerful anti-inflammatory drugs. Inflammation is a major player in COPD and its exacerbations, leading to swelling and narrowing of the airways. Corticosteroids help to reduce this inflammation, further aiding in improving the patient's breathing. Lastly, based on the suspicion of a bacterial infection, we started the patient on antibiotics. These drugs kill or inhibit the growth of bacteria, addressing the root cause of this exacerbation. Our patient responded well to this comprehensive treatment approach. Over the next 5 days, we saw a significant improvement in her symptoms. This was a rewarding outcome that validated our diagnosis and management strategy. To seal the deal, the sputum culture result came back positive for bacterial infection, confirming our suspicions and justifying our use of antibiotics. This underlines the importance of prompt, appropriate intervention in such cases. By closely following the guidelines and treating each aspect of the patient's condition, we were able to help her get back on track. Reflecting on this case, there are some important learnings and reminders for us as healthcare professionals. One of the standout points is the importance of quick and suitable intervention in cases of acute exacerbations in patients with COPD. As we've seen with our patient, her condition worsened over a span of 2 days before she sought medical attention. COPD is a chronic illness with potential for acute flare-ups or exacerbations. These episodes can lead to a rapid decline in a patient's health, so being able to recognize and manage them promptly is crucial. It is also essential to appreciate the role of patient behavior and decision-making in the management of chronic illnesses. Our patient experienced a delay in seeking medical attention, which could have potentially worsened her condition. This might have been due to a variety of reasons. She might have underestimated the severity of her symptoms, been unaware of the signs of an exacerbation, or faced barriers in accessing healthcare. This brings us to an important reminder about the value of patient education. As doctors, we play a significant role in educating our patients about their health conditions. In the case of chronic illnesses like COPD, it's important for patients to understand their disease, the potential complications, and when to seek medical help. However, this case shows that there's always room for improvement in the ways we educate our patients. We might need to explore more effective strategies or tools for patient education, to ensure that our patients are equipped to manage their health as best as possible. This could involve more detailed discussions about their condition, providing written materials for reference, or even referring them to patient education programs. In summary, reflecting on this case reinforces the value of prompt, appropriate intervention and patient education in managing chronic illnesses like COPD, and highlights the need for us to continually improve our practices in these areas. In treating this patient's condition, we based our approach on the latest and most credible medical knowledge available. Specifically, we relied on the GOLD guidelines for managing COPD exacerbations. These guidelines are the product of extensive scientific research and expert consensus, providing a clear and detailed roadmap for optimal patient care. These guidelines recommend several key interventions for managing COPD exacerbations. These include the use of bronchodilators, which help to open up the airways and improve breathing, corticosteroids, which can significantly reduce inflammation in the airways, and antibiotics, which are indicated in cases where a bacterial infection is suspected as the cause of the exacerbation. In our patient's case, all these interventions were needed. We began by administering bronchodilators, to address her difficulty breathing. This was followed by corticosteroids, to reduce the inflammation in her airways that was contributing to her symptoms. Given the presence of green sputum and the results of her chest X-ray, we also suspected a bacterial infection, so we started her on an appropriate course of antibiotics. The adherence to these guidelines was crucial in guiding our decision-making process and ensuring that we delivered the best possible care for our patient. As healthcare providers, using evidence-based medicine ensures we are using interventions proven to be effective, which in turn leads to better patient outcomes. To wrap things up, we should emphasize the significance and the complexity of COPD, a disease that many people live with, yet one that can drastically worsen if not properly managed. Acute exacerbations, such as the one we witnessed in our patient today, can often present suddenly and unexpectedly, thus requiring a swift and well-informed response from both patients and healthcare providers. This case underscores the importance of patient education. It is critical that patients, especially those with chronic illnesses like COPD, are able to recognize early warning signs that their condition may be worsening. In this case, symptoms like sudden breathlessness and coughing up greenish sputum should prompt immediate medical attention. Equipping patients with this knowledge can lead to earlier intervention, potentially preventing further complications and promoting better overall outcomes. As healthcare providers, this case provides us with an invaluable lesson: the need for continual learning and growth in our roles. We are tasked not only with diagnosing and managing diseases, but also with effectively communicating and educating our patients about their conditions. We should strive to further enhance our skills in these areas, as our competence directly impacts patient care and outcomes. In conditions as common and potentially severe as COPD, our ability to recognize, manage, and educate effectively can make a significant difference. So, let's take this case as a driving force to continually improve and provide the best care possible for our patients. That wraps up our discussion for today. I appreciate your active participation and attention. Thank you all for your time and engagement. See you in the next case. This is your online medical educator signing off.